So, want to welcome and thank you all for coming. It is a delight to be back in Frisco. It's always a delight to get out and about in Colorado. We've spent the last 3 days, I don't know how many miles we've covered, well over 1,000 miles. We've gone a huge big loop. And the idea is when the 120-day General Assembly fiesta concludes every year, the first week in May, we try to go out and meet with the legislators who have worked hard to find compromises and get bills passed, and actually give them an opportunity to talk about the bills and what they've been doing in their home community. It's always a great excuse for me to get 3 days, 4 days, and we'll do this for the next month. We'll be going back and forth. I think I come back through Frisco in a couple of weeks. But it's a great opportunity to get out and again see the whole state. We have had a little bit of moisture on the trip, but that's a good thing. And you will never ever hear me complain about rain. Even in 2013, when we had the floods in September, I had to bite my lip, but I did complain about the rain then. It's true. Anyway, I want to make sure you all get a chance to meet the state has a new chief operating officer, who also is now the lieutenant governor, Donna Lynn. Donna, less than 1 week ago, was the executive vice president of Kaiser Permanente, and basically running her area of control was 4 states outside of California, roughly $8.5 billion. I can't remember, something like $8.5 billion. She understands how large enterprises work, but she also spent 20 years earlier in her life working for 4 different mayors of New York, Democrats and Republicans, and actually was director of operations for the city of New York. So she's got public service in her blood, as well as being able to really manage a large, complicated enterprise. So when you see her, just do what I do all the time, which is bow down to her. Thank her for taking a rather significant pay cut in the efforts of being in public service. We're very, very grateful. So this bill obviously is about how we look at health insurance and pricing in the state of Colorado. And historically on these bill signing tours, I always would, because I'm the governor, I can tell all the really cool stuff about the bills. But this time we're going to take a different tack, and we're going to actually give the legislators meaty subject to talk about their bill. So I don't know who was the primary sponsor of this bill.
I think I was.
All right.
I think that would be me.
Representative Millie Hamner.
Yay, Frisco, Summit County. Wow, this is an amazing turnout. Well, it's a pretty special day when the governor of Colorado chooses Frisco for a bill signing. So, Governor, thank you so much for being here. And, he has been pretty busy, and I have to say, I got up at 4 a.m. this morning just to keep up with him, and made the drive over to Crested Butte for my first bill signing at 8:20 this morning. Made it back in time to be here with all of you, and I'm really glad I did make that, because this is so special. We have all our county commissioners here today. We have Dan Gibbs, who's been instrumental with this bill. And we have Thomas Davidson. I don't see Karn, but I know she would be here if she could be here. And we have folks from Leadville. We have one of our county commissioners, Mike Bordonia from Lake County. And we have from Garfield County, we have Tom Jankowski. Is over here. There he is. And I think that is a testament to the fact that this bill has had widespread interest and concern across the counties, not just Summit County, Garfield County, Pitkin County, Eagle County, Gunnison County, and Routt County. Excuse me, you're going to have the mic here in a second. But really, I have to give a huge shout out to Dan Gibbs, because Dan, as you know, really, Dan Gibbs, once again. Because Dan really got us motivated. Not that we weren't hearing from all of our constituents about what are we going to do about affordable insurance rates for healthcare. I think we've done an amazing job getting people covered who qualify for Medicaid, which has been fantastic, but we have a lot of people who are working really hard in our mountain communities and are trying really hard to make ends meet and just can't get there. We heard testimony from people who drove all the way down to Denver to tell us their stories about how unfair it is that people who live in Denver pay half as much as we have to pay for the same coverage here in our mountain communities. That's just not fair. So Dan really spearheaded the communication and kind of getting everyone organized. I'm really disappointed that Bob Rankin isn't here. He carried the bill with me in the House. He's my Republican co-prime sponsor on a lot of legislation. And but Diane Mitch Bush here from Routt County was also instrumental, as well as Senator Kerry Donovan and also Senator Ellen Roberts. So I'm going to pass the mic on down, but I just wanted to say thank you to all of you for being here today, for caring about this important issue. To me, it's really raising awareness about the importance of this issue, putting in place a policy that gives us a study of the feasibility of having one geographic rating system for the entire state. We think that'd be much more fair. We don't know if it's going to be feasible. The report will be ready and presented to me as a member of the Joint Budget Committee August 1st. So it's quick, and hopefully we'll see what happens from there. But Diane Mitch Bush.
Thank you, Millie. Great to be in Summit County. I know all your commissioners, and I know a lot of other folks here. Working with Millie is always absolutely wonderful, and I want to again give a shout out to Dan Gibbs. Dan really pulled everybody together. As I think you all know, this has been an issue for a long time. I first typed in 3 zip codes on the Connect for Colorado in 2013. 80477 Steamboat, 81632 Edwards. I represent Eagle County also. And 80203, which is, of course, right around the Capitol. And I was pretty sure I knew what I'd find, but the discrepancy shocked me. Not only did the 80203 zip code have a lot more plans that one could choose from, but the lowest price plans in our neck of the woods, in our mountain counties, were considerably higher than the lowest price plans there. So I immediately went to Marguerite Salazar, who's our wonderful Commissioner of Insurance, talked to her about that. I talked to her about risk pools. As I think you all know, the bigger the risk pool and the more diverse the risk pool, the more those costs are spread out, and the more diverse types of patients and cases you have. Therefore, theoretically, the cost should be less, and therefore, theoretically, our premiums should be less. So I am so excited that Dan and Commissioner Jankowski and just a number of other folks, Commissioner from Lake County, all commissioners from Summit, commissioners from Routt, commissioners from Eagle, got together with us legislators and put this bill together, and that it passed. Because we weren't sure at first that it would, but it did, and we all worked hard, and it's an awesome thing, and we'll see what those data show us, and then we'll see where to go from there. And hopefully we can find some solutions. Thank you all for being here.
Good afternoon, everyone. So glad to be back in this wonderful space. I think it was just a year ago we were here for another workforce development bill. So a wonderful space, glad to be here. This was a really neat bill to work on. I started hearing about this issue when I was a candidate, and that's when the news came out that our mountain resort communities were not only the most expensive in the state, but the most expensive in the country. We like being number one, we don't like being number one in that category. That's not the number one rating we want. So, you know, it started to be an issue then, and then as we redid one rating area, more areas got caught up in being some of the highest costs in the country and certainly in this state. And so we would hear about it at town halls, we would get emails, we would get phone calls, and then we finally sat down and said, well, let's figure out how to do something about this. And there was lots of ideas thrown out about, and I think what I appreciate about this bill that was really neat, that doesn't always happen, is there was citizens, local electeds, county commissioners, and state officials all coming together, throwing ideas around, and then coming up with a pathway forward that we thought would improve all of our diverse and different communities on the western slope and upper Arkansas Valley. So this is really how lawmaking should happen. And the tight time frame on this, we'll get results by August. The additional data that we'll gather through this study of not only looking to see if the single geographic rating works, but also what's driving these costs, so we can look at other solutions besides just the single geographic rating. Really proud of this. I just want to add some thanks to the hard work of all the county commissioners that rallied around this bill. It was an amazing effort down at the Capitol. You guys really had a powerful voice there. But also want to thank folks like Alice and Chris and David in the back, our citizen activists who ran a petition, gave a really strong voice for Leadville, added a great voice for the small business community. So thank you to you guys and others for helping us get this bill, and if the governor signs it, into law. Thank you.
All right, let's make a law.
Let's make a law.
Wait a minute, what bill?
Wow, that's a lot of smartphones, everyone.
Terrifying, isn't it?
Something like your haircut.
SCTV. I'm here with Governor John Hickenlooper. Governor, you just signed House Bill 1336, a bill that directs the Division of Insurance to look at cost variations of health insurance around the state. We really appreciate you being up here. What was it like to be up here in Summit County and sign this important bill?
It's always great to be back in Summit County and always good to get out of the metro area, all that traffic and congestion. The weather's been spectacular, so it's kind of a special. It's been kind of cloudy and sunny and cloudy. It's a true Colorado spring. And this bill really is looking at what are the tools we have available to make sure that we don't have such a wide disparity between healthcare costs in the rural areas and in the urban areas.
Great. Governor, I know last week you finished up the 120-day legislative session. Busy year, of course. What's your takeaway from the legislative session? I know you're busy signing bills, of course, all over the West Slope, all over the state of Colorado, but what's your takeaway from the legislative session?
Well, obviously we didn't get some things done. We were not able to get the hospital provider fee through the Senate, and we couldn't get a compromise on the construction defects bill to allow more developers to build more condominiums. But other than that, overall it was a pretty productive session.
Governor, you recently selected your new Lieutenant Governor, Donna Lynn, and tell me about Donna Lynn's background and why maybe in Summit County we'd be excited to have someone with her background in healthcare.
Well, she's got an interesting background. She had spent 20 years in the early part of her career working for 4 different mayors, both Democrats and Republicans, in New York City. At one point she was the Director of Operations for the City of New York. So she understands public life and public service. But she also spent the last 20 years in healthcare. And most recently, she's Executive Vice President of Kaiser Permanente for the whole shebang, and had sole responsibility for the 4 states outside of California. So Colorado, Hawaii, Washington, and Oregon. That was an $8.5 billion enterprise. So she understands healthcare, and she believes in the importance of equity in healthcare.
Well, we're really excited that she's on your team now, and she's an avid skier. She comes up the mountains, as you know.
She did 1 million vertical feet. I think it was last year, or maybe the year before last, and she's climbed every 14er. She is a remarkable. She didn't start climbing 14ers till she was 52. She's climbed all 54. What a woman!
It's amazing. Again, Governor, thanks so much for coming up to Summit County. It really means a lot to us that you signed this bill right in our backyard, right in State Representative Millie Hamner's backyard, and we really appreciate it. So thanks again.
Well, Millie Hamner does a great job. She's her work on the Joint Budget Committee helps all of Colorado, but she really does a great job representing Summit County.
Great. Thanks so much, Governor.
You
appreciate
bet.
it.
Good to see you, Dan.
Yeah. See you.